So good day everyone. Today I will be performing a post-mortem care. This is a physical care for a dead body. It is usually done in a home facilities or in hospitals in order to prepare the body for viewing of the family and to prevent um, any discoloration or deformities in the body of the patient. And we also must be aware of the cultural and religious consideration while doing this or delivering this care to the patients. So first, I'm gonna check for the patient's chart or patient's record and the physician's order in order for me to check if I give this to the right patient or do this procedure to the right patient. And this must not be performed if the doctor has not pronounced the death or said the death of the patient. So after that, I already prepare all the equipments that I need so I can save time while doing this to the patient. And after that, I will ask or explain the procedure to the family of the patient and ask them if they want to remain here inside or outside during the procedure. So after explaining and asking for the permission of the family of the patient, I will now give the privacy or close any curtains or door in the room of the patient. And after that, I will put a warm water on the basin so I can prepare for the bed bath. So before doing that, I will now perform a hand hygiene and put my gloves on. Put my gloves on. So after putting my gloves on, I will now proceed to remove all if there's any accessories to the patient. Okay, I will now check if there's any left. So after removing all the accessories from the patient's body, I will now close the patient's eyes to respect her and respect for the body of the patient. And after doing that, we are now getting to proceed if there's any tube or if there's any equipment that are connected to our patients. So after removing that, I will now remove the clothes of the patient and perform a bed bath. So, by doing the bed bath, let's still make sure to give a privacy to the patient, even though she is already dead. Um, let's not, let's still cover the part of her body. After giving the patient a bed bath, I will now put a cotton balls in her eyes, nose, and in the ears. So the secretion water from the eyes and from the nose and ears will go drain straight to the cotton balls. And after doing this, we need to also put a cravat, like we don't have, but we will use a linen. This is to prevent the opening of the mouth or dropping of the throat of the patient. We will just tie it here. And after doing this procedure, we will now give the family of option if they want to um, view the patient, and I will accompany them if they do so, and encourage them to say goodbye to the patient. And after encouraging them and give them a privacy, after giving them to say, asking them to say goodbye to the patient, I will now give a name tag to the patient's arm and legs. And after putting a tag on the patient, I will now cover and secure her. And after securing her, I will also need to put a tag on the patient. And secure this bag with a safety pins. also to the other side. And after that, we also need to put a name tag to the bag. And we will now transport this body to the morgue for embalming or any autopsy that they will do to the patient's body. And after that, I will now document the patient's information and the care outcome of this procedure. And after that, I will now clean and remove my gloves and put all of this used or any dirty linens in the dirty bag. So yeah, thank you so much.